Okay, and now I am very excited to welcome to join us this afternoon Charmel Robinson and Erin LeCoyne, who are principals at Eagle Academy Public Charter School. They are here. They're going to share some of their experience with us. And if we go to the next slide, Charmel and Erin, I would love to just start with a little bit of background on Eagle Academy, if you could share that.
All right. Good afternoon, everyone. I'm Charmel Robinson, one of the principals here at Eagle Academy.
I'm Aaron LeCoyne, the principal of the upper school.
And we're just going to start, as Caitlin said, with a little bit of background information. So Eagle Academy has actually been in operation for 20 years. We're actually coming up on our 20th anniversary in the 2023-24 school year. We are in Ward 8. We serve students in Wards 7, 8, and I think we have a few coming from Ward 6. We serve grades pre-K 3 through 3rd grade. So those are children ages 3 to 9 years old, and we are a Title I school. We also are a community school, meaning we have quite a few partnerships with community organizations, some of them being local health organizations in our neighborhoods that also help us with our immunization, enforcement of our immunization policy.
Awesome. Thank you so much for that. Now we're going to dig into a little bit of your process. So can you start with just walking us through what your process for enforcement looks like that you've been doing at Eagle?
Absolutely.
Yeah, so again, one of the things is just reinforcing those requirements. We've been doing that for more than 10 years. So one thing that we know is just preloading as much and as often as possible with both our staff and our families. So you will see that we have reminders about the immunization requirements at the start of the school year. So that is during enrollment events that we will have, parent orientation as parents come in. It's also mentioned in our handbooks as well as back to school night. So we will have nurses on hand for back to school night to talk to any families about any health issues, but also looking for those particular families that may be moving to compliance issues. And of course, we do have those weekly compliance reports so that we have our nursing staff who are digging through those records and seeing those compliance concerns and then reaching out immediately each week for those families.
And so just to kind of follow up with Mr. A, we typically have our nurses, our health department on staff with us during our enrollment events, doing parent orientation as well, so that we can, one, let parents know the face of our health department so they're familiar with them, but also providing immunization information and also having the nurses kind of speak to families who may be within that 20, coming within that 20 days of being non-compliant before the school year even starts, so that we're getting those kids that might be coming up on non-compliance within those first few weeks of school.
Thank you both for that. I heard you mention related, can we stay on that slide for a second? Related to the compliance report. So I heard you mention that, like, obviously your school nurse is involved, some of the front office staff that maybe are accepting enrollment paperwork, but can you walk me through, like, who else in your school is involved and how do they share information amongst the group?
Right. So we have all hands on deck kind of thing here. So the administrators, the school nurse, our enrollment department, our attendance office, and our parent engagement coordinator, who also is a social worker. All of us are aware of the immunization policies, and we check in. We do a weekly check-in with the nurses. The nurses also send that report out to the team so that there are multiple eyes on the report, and we can check in with each other and say, hey, okay, let's go over the report. Let's see what kids are coming up within that 20 days of being non-compliant, so that everybody has eyes on it. Everybody is aware of where the needs are and what work we need to do. So that, for example, if it's a family that the parent engagement coordinator has a better relationship with, then maybe she's the one who's reaching out or getting in the face of those parents. If it's a parent that the registrar has to deal with or has recently had an interaction with, then we have those hands. So we have multiple hands because we realize that parents they have to go to multiple departments for a reason. And it's helpful to have more than one set of eyes and hands on it to make sure that one, we're getting in contact with the parents that we need to contact and that we're informing them as soon as possible.
Great, thank you for walking through that really whole school type of approach to think about all the touch points that a parent has. We can go on to the next slide. So we were kind of focusing on the before part of enforcement, and then I know here you get a little bit more into what happens once a student is non-compliant and is going to be excluded. So if you could walk us through that.
Absolutely. So let me start first by saying this is not something that happened overnight. We have been working overtime to refine our process. We review it every year just to see if there's anything else that we need to tighten up on or something that works before that doesn't work now, and especially post COVID, so to speak. We definitely made sure we review what we've been doing in the past to see if it's still is applicable now. So this is not something we just happened upon, but it's something that we've worked at for quite a while. And so our process really begins with those weekly reports and pinpointing the list of kids that are coming up on their 20 days of being non-compliant. And so those students are identified, and once those students are identified, that's when the first call goes out. And that team that I mentioned before, the school nurses, the parent engagement coordinator, the attendance officer, we usually break those depending on the number of students. If it's a small number of students, then the nurses will take charge of calling and making the first courtesy call. But if it's a large number of students, then we typically break it up amongst the team. And that first call is just to say, hey, mom, dad, guardian, your student is coming up on an expired physical or immunization or dental certificate. So this is a courtesy call to let you know, if you haven't already scheduled an appointment, that you need to schedule an appointment because they're coming up on the expiration of one or all of these items. So they're at risk of being non-compliant. After 2 or 3 days, we give a follow-up call just to make sure that they're aware. It's a reminder, hey, we've called before, just to let you know that you might want to make an appointment if you already haven't made that appointment. Once we make the second call, then that's when about a week later, we send out the reminder letter that says, hey, we've already contacted you twice about this. We want to make sure at this point, if we haven't received confirmation of an appointment or if they haven't presented the updated documentation that we need, then the notification letter goes out within 7 days of that second reminder call that says, hey, again, your child is at risk of falling in non-compliance with these particular health items. Please make sure that you either provide documentation if you already have it, or that you're scheduling an appointment and can provide as proof of an appointment. And so that reminder letter happens 7 days after that second reminder call. Once that goes out, we wait until they are within that 10 to 12 days, which is halfway through that 20 days of being non-compliant. And that's when the second letter goes out. And the second letter only goes out if we haven't received either confirmation of an appointment or they haven't produced the up-to-date documents. And that second reminder is saying, hey, now you're about 10 days out, 10 to 12 days out for being non-compliant. We want to see if you scheduled an appointment. We want to see if there are any resources that you need from the school or any assistance you need from us at this point to help you schedule an appointment or get access to the services so that your child doesn't become non-compliant and be faced with exclusion possibly. And then once that second reminder letter goes out, we do a third courtesy call within 7 days of the child being non-compliant. If we receive no response from the parents, we haven't had a confirmed appointment, or they haven't submitted documentation to say, at this point, we're about a week out from you being non-compliant. The exclusion is a possibility if you hit this date and we don't have a confirmed appointment or you haven't presented us with the documentation. So what is an obstacle? Is there something that the school can do or a service that we can offer or something that we can assist you with in making sure that your child stays compliant? It really happens, but in the instance that it does happen, and then of course, the date comes and we haven't received a response from the parent or a confirmed appointment, then that's when the exclusionary notice will go out.
Great, thank you for walking us through that process. And I want to echo, we know that you have 10 years of experience to get to this process, but it's so great to be able to hear what it looks like. You mentioned here on your slide, making sure that you provide families with local resources, and you mentioned at the top of our little chat together that you partner with a lot of community partners. So how did you initially find out about different resources and opportunities, and how do you stay up to date on those resources to inform that bank of options that you inform families about?
So a couple of different ways. So one of the ways is our parent engagement coordinator is the one we usually task with kind of being in the community. She's also a social worker, so she's privy to resources in the city that most schools may not normally be privy to. So she's usually tasked with knowing what health facilities are available that are giving either physicals or vaccination support or dental support, and also reaching out to local health organizations in our ward that will be willing to come in and provide services or offer appointments for families. So our parent engagement coordinator is usually the one who works with the organizations in that manner. And then once she collects the necessary information from them, then we usually come to the table with the organization to determine if a partnership is possible and what that partnership looks like. And she's also privy to the resources that OSSE, like you guys had on the slide before, all the resources that you guys had on the previous slides. She's also very well versed in, checking with OSSE, checking with DC Department of Health to see what services are available so that we can give that information to our parents or have it available with our parents, because we realize, no parent is intentionally not getting their child the health care or the immunizations that they need. Our parents deal with a lot, especially the demographic that we serve. They have a lot going on. And so we just want to make sure that if they have an obstacle that we can help address, that we're doing that by providing them the resources, because we know, no parent just doesn't want to have their child compliant. Sometimes they're doing the best that they can, and we just want to make sure that we're giving them resources that can help with that process, so that we want the kid in school at all times. And so anything that we can do to support that, we try and do.
On that same topic of staying in touch with parents, working with the parents, how do you stay in touch with families in the event that a student is excluded? How do you keep in touch with the family after the date of exclusion?
So we have our attendance officer and our parent engagement coordinator, as well as the nurse, do what we call wellness checks or check-ins. And so if it comes to the point that a child is excluded, usually about, I would say maybe three to 4 days after that exclusion notice, maybe 2 to 3 days, we'll just have them check in with them, call and say, hey, mom, dad, guardian, parent, we're just checking in. We know that the student was non-compliant and you weren't able to either schedule an appointment or give us the updated documents by the exclusion date. Have you made an appointment? Do you need help, making or finding a space? Is it transportation that you need? So we try and do check-ins with the parents within 2 to 4 days after the student has been excluded, to check in to say, hey, we're not just leaving you out there. We definitely want to check to see if you're addressing this, because we want your child to be in school. And so we try and do at least 2 checks to see what's happening. If the parents are non-responsive, then, we have to, with the social worker, we have to take a different kind of step. But usually most of our parents, if they happen to get an exclusionary notice or the child is excluded, usually within about a week, maybe 2 at the most, they usually either bring the updated documents or have proof that they've scheduled an upcoming appointment.
Great, thank you for that. And then if we could go on to the next slide. So you've talked a lot about the process, the people involved. So I just wanted to give you an opportunity to talk more about these kind of key ingredients that you've touched on, but to really talk us through each of those ingredients.
Right. So I think what the biggest takeaway that we've had is that over communicating. And I also think it's the perspective that we have. And this is like Ms. Robinson stated, coming with a perspective of no parent wants to keep their child out. No parent doesn't want to have their child immunized. There just may be roadblocks in the way. So coming with that perspective, I think already kind of lowers the barrier or the wall between school and home, where now that parent feels like we are trying to add. And so I think adding those resources, giving them that, gives the opportunity of like, we know that you need help and we want to provide that. So over communicating can't be stated enough. I mean, and while it should not be badgering, it really should just be like, we know you want, the assumption is we know you want your child in school. We want to try to help and get these appointments set up for you as soon as possible. I think the timeliness is also another important factor. So us being like ahead of time, like I said, front loading and knowing ahead of time who's coming up, early identification to start having those conversations with those families is a big help. The parent engagement is huge too, because like I said earlier, we make sure we have all parties involved in all kinds of things. So looking again at your school, looking at the times that you have families coming into the building, what kind of events, even if it's something like literacy night or something as complicated, or even parent conferences, having that nurse, having some of those folks available to speak to parents. It was one of the reasons why we also have a multi-tier approach, multiple departments, so that that attendance officer sees that family when they're coming into their child is late to school. That person who's there can do those reminders. Even somebody at the front desk when they're going to sign their child out for before care or after care, if there's a name there. So just having all of those folks on deck and aware of the information to really help families. And like I said, coming with an approach of we're trying to help you, not trying to penalize you for what you haven't done, and having the assumption you're purposely not trying to have your child immunized. I think that was one of the key ingredients and what made things more successful.
Awesome, thank you. We can go on to the next slide. And I know you mentioned you're 10 years into implementing these processes, but I know there's also probably always learning new lessons each year and tweaking the process. So I wanted to provide the opportunity to talk through some of your potential future changes that you're considering.
So one of the things that we in our tech savvy world that we know would be a lot more help for us is working on like an internal system where maybe we're using Power School to easily identify kids who are, where it can kick out notifications to team members when students hit that within that 20 days. So we've been working with our tech department to see if that's possible with the Power School platform that we use, or if there's another platform that we could get that would help us kind of be able to get like notifications and things of that nature that can help us kind of streamline and get our list of students together, aggregate that data and that information for us, instead of us having to come together as a group and go through the list and then compile the names of kids who are within it. So looking at ways to kind of refine our notification process and how we aggregate that data and find one kind of storehouse for it for everybody. The other is we're always looking for ways to provide more in-school services. So one of the things that I'm glad we've gotten back, we haven't had because of COVID in a while, is a partnership with a local dentist. And so that partnership was revived again this year, thankfully. And so this month, and I think again in another couple of months, we have a local dentist who's coming into our facilities for 2 days, beginning next week, to service students, to provide dentistry services to students. So a lot of our students who have dental certificates that are expiring soon have already made appointments to see the dentist here at school. So it's no extra It's not an extra layer of effort on the parents because it's something that they can do here. So we kind of push a lot of parents to kind of sign up for that. So we're always looking for other organizations in which to do that. So we've also been able to connect with children's. And so we have, hopefully we'll have an immunization physical mobile van in January to catch students for immunizations and for physicals then. And like I said, the dentist will be back again later in the year. So just trying to build more community partnerships so that we can just not give parents the resources of, hey, here's a spot or a facility that does it, but that kids can actually get serviced here. So we're also looking at bringing our vision program back. So years ago, we had a partnership with a local optometrist that came in to do the visual screening. So just trying to revive some old partnerships and start some new ones so that we can offer as many services as possible in-house so that parents don't have the extra layer of worrying about, having to go to a facility or if it's a transportation issue or what have you, but just trying to eliminate as many barriers as we can. So that's always a part of our refining process of what else can we do? What extra layer can we add on our school if we're calling ourselves a community school to make the experience for parents as easy as possible for not only our parents, but for our students as well.
Yeah, I mean, I think that just really connects back to everything you've said. It's all about meeting parents where they are, it sounds like, with having the whole team approach where so then whoever the parent is most comfortable with, to, going in with knowing that parents want their students in school, to then connecting them with resources in the way that makes the most sense for them. That really seems to be that combined with over communicating as the common thread.
Yes.
Oh, sorry, I didn't mean to cut you off.
No, I was agreeing with you. Yes.
I would encourage folks to drop any questions or comments, thoughts for Eagle Academy in the chat. And I have one final question that I wanted to ask you both. So we know you've been enforcing the immunization requirements for 10 years, and we know that other schools on the call might be in a different place where they maybe haven't been enforcing for several years and are getting back into it. So if you could try to think back to when you first started this process of enforcement, what is some advice that you would give yourself in that first year?
So the number one thing I would do, because I remember that first year, the number one thing would be to do things in chunks. Be realistic with your goals. You may have, you can't do everything at the same time. So one of the things that worked best for us was doing things in chunks. So one year was like, okay, well, how do we improve identifying students, and what do we want the notification process to look like? And so just taking it chunks. And so that's what, after we figured out trying to do everything at one time was a total disaster, it was like, okay, let's look at this in chunks. What can we realistically do? And the first thing we can do is find a better system to identify the kids ahead of time. So let's work on that. Let's refine that. And then the next year we'll add on something new so that, okay, we know we've got identifying the students set. Now let's look at how we notify our parents. And then taking it in chunks like that is actually what allowed us to really see the process, to see what holes and gaps we had in different areas of our process, and to refine it to the point where it's like it is now. But it was definitely taking it in small, realistic chunks and focusing on areas that we could realistically target at the time.
Great, Charmel and Aaron, thank you so much. Again, encourage folks to put comments or questions in the chat for Charmel and Aaron about Eagle Academy's experience. Thank you so much for sharing with us. I do see a couple of other